Hello, everybody. Hope everybody's doing well. It's Dr. Bailey from Dr. Bailey's Evolved Health and Wellness. Got our Medical Monday getting ready to kick off here. It's a little bit of a chaotic week if you've been following or haven't been following. We got a fight this weekend in Oklahoma City at Farmers Market. Saturday for Rage in the Cage. Let's see here. Um, we have some tickets we're going to give away to that event. Let's see if I can pull up. And I am going to do my best to tag the winners if it'll let me. There they are. MedShed folks in Arapahoe, Oklahoma. They have won the 4 general admission passes to our fight this weekend. So hit us up on Messenger and we'll get you guys lined out. I'll have those at will call for you. That way you can just walk in, grab your tickets, come in, enjoy a night of fights. Pretty excited about it. It's gonna be a really good night. I've a lot of people are aware, some people aren't. We're actually shooting a kind of a video series to show kind of what goes into preparing for a fight and what my daily schedule's like. It's been pretty grueling the past few months. It's been a constant battle, 4 a.m., 4:30 a.m. wake ups for about 11 or 12 weeks now. So we're in shape and we're ready to rock and roll. Today's topic, we're going to hit on a topic that I come up a bunch, ADD and ADHD. Something that I hold kind of near and dear to my heart. I was on high doses of Adderall for quite a long while, so I kind of have experience in that regard as far as the medication, pharmacological treatments. And then when we start looking at, cannabis, how and why does it work? And um, the big thing to look at with ADD and ADHD, for one, it's misdiagnosed a lot. It is something that it typically coincides with a lot of other psychiatric conditions, anxiety, depression, bipolar, personality disorders. I mean, there's all kinds of issues that are attributable. Right now, it's like 4% of all North American folks aged 18 to 44, I believe, are diagnosed currently with ADD or ADHD, some form or variable of it. And the treatment is, for lack of better words, amphetamines, and whether it's Adderall or Ritalin or Vyvanse or whatever that medication is. I'm a big proponent of trying to come off of those meds. And if you've had a recommendation from me and you are on those meds, we've had that discussion. There's a bunch of reasons why. For one, causes irritability, lack of sleep, worsens anxiety. You usually have some sort of appetite suppression as well, which is hard in a lot of these kids, myself being one of them. I know that whenever I had to go to the psychiatrist for refills every month, I had to do a weight. We had to step on the scale and see if I was able to maintain weight. And for a long time, I struggled with that. And so, just one of the many reasons to look at trying to wean it down. Second of all, it's actually, it is the most abused drug in all of college campuses right now. It outruns Xanax, it outruns a lot of these other medications because, people can, for lack of a better word, you can procrastinate and then you can, cram study overnight and get a lot of information, swallowed on your head, but you just may not remember it. Now, ADD, ADHD has typically been linked to lower levels of dopamine. Now, there's a lot that goes into it because there's also a lot of different studies that kind of contract, with ADD and ADHD. What is there an intellectual difference? I was one of those kids that I spent a ton of time in detention, broke stuff, got in a lot of trouble. And it wasn't until about fourth grade that my teacher pulled me out of class and she said, Brandon, are you bored? And is that why you're getting in trouble all the time? Because I was in trouble a lot. I spent more time in detention than out of detention in elementary school. And so, looking at it from that side of things, yes, I think that there's probably going to be some correlation there between long-term intellectual capabilities. Uh, it's hard to say, but we do have a ton of research in that area. Now, why does cannabis help with that? Because we know that cannabis, especially THC and THCV, in some of the terps as well, beta pinene and beta caryophyllene, or no, oh, set my notes down. Delta 3 carrying. There's a couple others that do a good job of helping to elevate natural dopamine levels. Now, whenever we're talking about, cannabis and ADD and ADHD, and like I said earlier, ADD and ADHD typically involves another issue, anxiety, depression. Anxiety is one of the biggest ones. I think we can all relate to a degree, even myself, that if you have real bad ADHD, you're usually kind of panicked in a way about trying to get this done and that done. And when you're working on one thing, it's hard to finish and focus on this because you're already thinking, man, did I finish that? And it causes you to get anxious, and then it builds on itself. So when we look at treating it with cannabis, it comes in one of two forms. We have some sativa varieties that do an excellent job with the higher THC levels. They raise dopamine levels and help us clear out a fog, and they help us focus. Now, the other side of that, though, many times we can actually go for like an indica hybrid or something that's going to be calming and relaxing and help combat the underlying anxiety, the underlying issues that seem to make the ADD and ADHD worse, and we can really find profound relief that way as well. So you have two different angles and two different directions that you can go depending upon your, oh, I hate to say just your endocannabinoid system, but your endocannabinoid system. We know that cannabis works based off of a deficiency that we all have, and we have it to varying degrees depending on our receptors, our dietary intake, our underlying medical issues, how well we metabolize, and then so on and so forth. Um, One big question that I get all the time is, well, which do you prefer? Which would you do? And honestly, it's hard for me to answer that question. I think what I have to look at is, an edible variety for daytime, long time release, because it's something that's going to affect you throughout the day. So you want to be able to get some benefit from it throughout the whole day and not just on that short time frame there. And if you guys have any questions, again, drop a comment over here on the side. I'd be glad to get to it and help out in any way I can. Share the post out, share the video out. The more people that can kind of get some information, the better. Charles, you're very welcome. Glad to always talk about it. If there's anything that you guys would like topic wise, again, shoot us a message, comment on one of the event pages. Let us know, hey, I'm really interested in hearing about this. It's something that we can definitely work on trying to do. I think I'm still trying to beat around the bush. I think pediatric dosing is going to, or pediatrics is probably going to come up soon. We did pregnancy last week, 2 weeks before we did pain. Side note, next Monday, there will not be a medical Monday. I'll be out of the state. Evolve is closed next week. But otherwise, we'll be back and running the following Monday. We'll get some good topics covered then as well. Now, terps, again, I kind of hit on them earlier. Um, it depends again on which direction you're going to go. If you're going to go for something that's calming and relaxing, terpinolol or linalool, or are you going to go for something that's more of a sativa dominant type deal, or something that's going to be predominantly found in sativa varieties? Whether it's going to be, Delta 3, carrying's a good one. Let's see what's the other list I got going on here. Limonene, myrcene again is going to be a good, and caryophyllene seems to come in just about everything. Bisobolol is another great terp that is typically found in sativas. Appreciate you, Mr. Early. Shout out to Kyle Early. He's got his veteran home front, or Battle on the Home Front, his veteran outreach group. He actually is the group that we are going to be donating money to at the Fights for Rage in the Cage for all the work he's doing in Oklahoma City area, just in Oklahoma in general with veterans. It's kind of a big deal from me, near and dear to my heart. Been in the military for about 12 years, so we appreciate you, Mr. Early, and we're gonna definitely hook it up this weekend. Let's see here. Now, when it comes to endocannabinoids, and my biggest gripe right now in the industry is testing, standardization of testing, quality of testing. We have too many times that patients are getting test results that aren't accurate or can definitely lead to confusion, I guess, in that process. When we look at endocannabinoids and how we're going to treat ADD and ADHD, It's a big deal when we're trying to determine which direction we're going to go. Because remember earlier I said you got two real directions that you can go. One being you can treat the underlying anxiety and depression and other issues there. Most of the time it's kind of something that's calming, helps you focus and relax. Kind of like, I don't know, some people can drink like green tea and calm, focus. It's something that you can then go the other direction and get, the sativa base, something that's going to give you energy and focus and drive, kind of like a shot of espresso. I'm also really well known for saying, hey, it's safer long term, infinitely safer to use high doses of caffeine than it is to use Adderall. You can use an exponentially large amount of caffeine and have relatively no side effects or harm from it. Disclaimer: does not go towards people with heart attack, stroke, coronary disease, high blood pressure, all those things, obviously. But yeah, no, I personally have swapped out for caffeine on multiple different occasions. But if once I'm out of the military, we'll definitely jump into much more of this into a broader scale. But so CBD, CBG, THCV, those are all going to be great endocannabinoids for like the calming aspect and help with dopamine to a degree. But your delta H, or your delta 8, delta 9 THC is going to probably be more potent in the dopamine raising. Now you have to find that fine line, and you have to really microdose to make sure that you're not going to get the proverbial head high, or just not really be the most efficient individual that you could be that day. That is something to always consider. All right, guys, let's see here. Let's see, I got everybody. Miss Geneva, Matlock. No, thank you. I appreciate it. I've been very blessed. I've been associated with multiple good units. Currently assigned to the Infantry Brigade over in Edmond, Oklahoma. I commute from Broken Arrow to Edmond over there quite a bit. I've been in the military for a little over 11 years right now. I'm currently a major. Got 2 more years left of my contract. Went to Afghanistan with the 180th Cav from McAllister in 2018. That was an interesting time. Otherwise, um, yeah. Let's see here. Miss Sanchez, no, I'm always happy to try and share real life experiences, at least from my how I form my point of view. Dakota Morrow asks, how hard is it to get off the Adderall after years of prescription mass dosage for a lot of that time? Um, Okay, so Dakota asks, how do I wean off Adderall? And this is tough because everyone seems to respond a little bit differently. Myself, I was on high doses. I was on about 80 to 90 milligrams a day, split doses throughout the day, and so that's kind of how I compared it. Honestly, with me, I was on it for 10, 12 years, something like that, maybe longer, and I just cold turkeyed it. Now I slept for about 18, 24 hours, and I was kind of in a fog for a little bit after that. Now, when you say caffeine barely has an effect, I think that depends on your doses. And this is not medical advice. This is me personally, and this is probably not the healthiest thing. But as much as I work right now, I use a lot of caffeine. Um, I typically run through about 700 to 900 milligrams of caffeine a day. My resting pulse is in my upper 40s, low 50s, and my blood pressure sets about this minute goes 118 over 60. So I work out a lot. I've lost a lot of weight, getting ready for this fight and whatnot. So I'm sure that plays some in there as well. What I would typically recommend is while you're titrating down on the Adderall, don't start titrating down. And this goes across the board for any medical condition you're treating with cannabis. Do not titrate down until you've found some strains and some varieties that seem to help, because all you're going to do is put yourself out on a limb with no support there and then go back. Yeah, if you're hitting a gram of caffeine a day, you're definitely hitting a lot. And so what I would suggest is look at your cannabis strains and look at to see what you can accomplish, which depending on which direction you go, because you may be, since you're so resistant to the uppers, the caffeine and the Adderall and whatnot, you may be somebody that just needs to be calmed down. And it may be something where you look at more of an indica hybrid for that kind of even out and then balance it out with caffeine. I mean, you can kind of go a bunch of different directions there. Um, like I said, for me personally, I was able to cold turkey and I just slept. I slept for a minute. I'm not gonna lie, I slept for like 18, 24 hours, but which is not me right now. I typically sleep about 6 hours a day on a good day. Let's see here. What else do we got going on? All right, Dennison, nice to see you, Ponca City. It's been my pleasure. Thank you, Miss Blaylock. And then let's see here. MedShed, there you go. MedShed, be sure to message us and let us know who uh, the names are you want the tickets left under, and we'll leave your 4 general admission tickets to the fights at the will call there. Let's see here, 70 beats per minute heart rate. So that means you're definitely getting the effects of it. Your body's kind of fighting it. Mentally, you may not be getting the dopamine release you need from it, but your heart rate, resting heart rate is 70s, and also depends on your age and some other things there. Uh, it's something to kind of consider and look at, Dakota. All right. And I also, Mr. Joey William, appreciate that. Um, I actually will have 4 additional tickets to give away to the fights. Um, haven't decided exactly yet how we're going to do that, what I'm going to do with that, but it is something that is coming up. I do apologize. Like right now, I get a lot of messages, probably about 25 messages a day. People needing sooner appointments, and there's just not enough days and hours in a day right now, unfortunately. What I'm seeing is first week in November, I'm going to have some more availability. We've opened up some Saturdays and some Saturdays for appointments. And just watch our page because we will be, or the websites, we will be opening up some hours as soon as I get back from being out of the country. All right, y'all. Let's see here. Make sure I didn't miss anybody. Not a problem, guys. All right, everybody. I try not to make these too long so that people can kind of tune in and get their information and then get back on with the rest of their Monday. This is Dr. Bailey, Evolved Health and Wellness. We have some really cool things coming up. Oh, I did want to throw out Green Country Bud on Yale and JKJ Processing here in Oklahoma for coming on board and helping with some sponsorship stuff that's going to help go directly to the veteran organization that Mr. Early is running in Oklahoma City. Hopefully everything goes well. Um, and we'll be able to present that check after during a winning speech, but we'll see how all that goes. It should be super exciting. Geneva Matlock, yes, all of our appointments are virtual at this time. You just visit the website, evolvedhealthandwellness.com, click on the red book your appointment button. They're all done via Zoom video conference. Mr. Bachman, man, I always love to see you guys there. If you cannot make the fight and you want to watch it, there's an app you can get. It's FITE.TV. You can stream it on your cell phone. You can stream it on a smart TV at home. I think there's 13 or 14 fights. There's a lot of fights on the fight card. Doors open at 6:30. Fights start at 7:30. I probably won't fight till 10:30 or so, maybe a little bit later. And then as soon as we're done, I'm hopping on a plane. So it's going to be a fight. It's going to be a speech. It's going to be cutting gloves off and jumping on the highway. So if I can help with anything between now and then, by all means, just holler at me. I hope you guys have a great rest of your evening.